Okay, so a couple of classes ago, you guys would have picked up a sheet that went over the bone anatomy. It was just a single sheet that I had copied off for you. You picked it up when you got your packets, as well as your bone label sheets. So it should look like this with the different definitions for the bone anatomy. And this is something that I would like to take a couple minutes and go over, and then we'll pull it back in as we continue to learn the bones over the next couple of weeks in preparation for the final exam. So when you look at the bone anatomy, these are structures that we have on the surface of bones that are going to enhance their ability to be able to do their job. We know that muscles will pull against the bones in order to carry out movement, but because of all the places that bones are, it would make sense that they have more than just that function. And so some of the different shapes and forms that you have on the surface of the bones is going to allow for more to happen than just that muscle attachment and allowing for movement. So this is a description of the different structures that we can see within the bones. And like I said, we'll just take a couple minutes to go through those, give a little bit more of an explanation than what you have through the sheet um, by itself. So you'll notice that it's broken down into different categories. You have the projections. You also have the articulations, which are joints. We just got done covering those, depressions, and then openings. So looking at the projections, these are formations that are going to arise off of the surface of the bone. And a lot of these are going to be for the purpose of muscles attaching or other soft tissue having a place to anchor and hold on to. When you look at the crest is going to be a narrow ridge that you have on the surface of the bone. One of the best examples that you have is the top of the hip, the ilium bone. There is a very wide band across the top of that bone, which would be the crest of the bone. Not the only place that you have one, but the best example of one that we have in the body. Now, I am going to pull these back in and show them to you on the bone models. Being on video right now doesn't really do a whole lot to show you. So we will go through these again. The next two terms that I want to talk about actually come in two different categories. So if you look at epicondyle and condyle. So epicondyle is under projections, articulations is going to be, or excuse me, condyle is going to be underneath articulations. And what you have when we talk about condyle is we have a form on the end of a bone, typically on the end of the bone because it's where the joint is going to happen, and it's going to be a very rounded surface. And this is just going to make the movement between those two bones a little bit easier. If you had straight edge bones that were coming together, if you think about a lot of the movements that we have to carry out, they would be very robotic. And that's one of the things that they have problems with on robots is they can't simulate what our joints look like. So on the ends of our bones, you have these rounded surfaces. That is the condyle. On the sides of the bone, so up above the actual condyle and where that is on the bone, on either side, you would typically have what is called an epicondyle, and it's like a little knob that you have on the side of the bone. It is positioned higher than the than the condyle. So the condyle would be the actual end of the bone. The epicondyle is going to be on the sides. Both rounded formations, and they help with that joint structure. For the line or the linea, this is a raised surface that you have almost on the bones that you have. It makes them look like a triangle because it comes to a little bit of a peak on the surface of the bone. You have one on the femur, which is very long and pronounced. Very good example of that line that you have on the surface of that femur bone. Then with the process is going to be an extension that you have off of the bone. And this is usually, again, pretty large in size, very pronounced, easy to see. Some of them are more knob-like and some of them are going to have sharper shapes to them. If you look at the vertebrae have a process coming off the back, and then they also have two that come off to the sides on a majority of your vertebrae. And that would be a process. So it's a very pronounced extension that you have off of the surface of the bone. Protuberance. Protuberances are a little bit difficult to identify. They're usually very subtle and they just look like more of a bump than anything. You have one that's on your skull, you have one that's on the back on the skull of what as well. But usually by the time you get done with muscle and fat and skin, it overlays those and you can't really see them. But if you see just the bone itself and it's a small little bump, those are going to be your examples of protuberance. For the ramus, it's called an extension on the bone. The identification of the ramus is that it's a 90-degree turn within a bone, but it has to be on the same bone. So you can't go from your upper arm to your lower arm and say that you have a 90-degree bend there. Yes, you do, but that's not on the same bone. So the jaw actually is probably the best example that we have. So the mandible comes down and then it turns and it comes forward. So it has a change of direction almost at a 90-degree angle, and that's what a ramus would be. Trick there is it has to begin and end on the same bone in the formation of that 90-degree angle. Spine is very much kind of like a crest. They typically are smaller, and that's really the distinction between your spine and your crest. So it's somewhat of a ridge that you guys have, or an extension that you have on the surface of the bone, but it's going to be a little bit more narrow than what we see with a crest. You have one that is going to form the main structure on the scapula. And again, when you guys get to see the scapula, very easy to identify on that spine formation that you have there. It actually sits up and is raised very much on the back side of the scapula. It gives a great place for muscles to attach to. For trochanter, tubercle, and tuberosity, these are three formations that you have on the bone, and they give you the large, knob-like, and rough elevation for the definitions. These are the same category, they're just different sizes. So trochanter is the largest of the three. Then you have your tuberosity, which would be the middle, and you have the tubercle, which would be the smallest of the three. And when you look at these, typically they are going to be rounded formations. They're raised up more than a protuberance, a little bit easier to see and to identify because of their size. So the largest one that we would have would be that trochanter. You have a couple of those on the top of the femur. You have some on the humerus as well. And then with the tubercle and the tuberosity, they're going down, decreasing in size. So trochanter is the largest, tuberosity is the second largest, that would be the medium, and then you have your tubercle, which would be the smallest of the three. So think more of a knob-like or rounded formation that is pronounced, easy to see on the surface of the bone. Then going down, we've already talked about condyle underneath articulations. Articulations, this is places where bones are going to come together. With the facet is going to be a bone formation in which the bone almost has a perfectly flat surface somewhere on it. At the end of the rib, you have, it almost looks like somebody took a knife and cut the end of the rib where it articulates with the cartilage on the front side, and that would be a facet. Likewise, on the back side where the ribs join up with the vertebrae, you have very flat surfaces where those two bones come together. So anywhere that you get a very flat surface to the bone, that's going to be your facet. And then head, I actually showed you this the other night in class when we were talking about the ball and socket joint with the femur, and I had the humerus as well. The large knob that you have on the end, that would be the head of the bone. And that is going to typically fit or meet with an adjoining bone. So you have the head of the femur, which would fit into the cup of the hip. Likewise, the head of the humerus, which fits into the scapula. But just usually an extension. These are found at the ends of the bones, which kind of sets them apart from your trochanter, your tubercle, and your tuberosity. This would be the very end of the bone that would be classified as a head. Depressions, you have two. Again, I showed you one of these in class the other night. The difference between these two is size. You have the fossa and the fovea. They are both described as depressions, so they would be lower areas within the bone where you actually are going to kind of have a valley almost that forms within the bone. Fossa is very large. A fovea is going to be very small. Openings that we have, it talks about a canal, and I actually want to compare canal and meatus together because they both pretty much have the same definition of being tube-like or tubular. The difference between the two is that with your meatus, it is going to open to the outside. With a canal, that is going to be contained within the bone. So you have this tube-like passageway, but it's internal. You know